Today, I've chosen an Epic Inpatient topic to present to you called Prior to Admission Medication Documentation. Hi, my name is Heather Bell. I'm an RN and an Epic credential trainer, and the reason I chose this specific topic for you is because I've seen a lot of people get a little mixed up with it. I'm going to share my screen so you can see what I'm talking about. And prior to admission medications is what we're talking about today. Prior to admission medications are the meds that the patient is taking before they come into your facility, and someone has got to document these on admission or upon admission for the patient. So in order to document these, you will double click and open up your patient's chart, and you'll go over into the activity section on the left-hand side, and you will click on the ADT Navigators, which is your Admission, Discharge, and Transfer Navigator. I know you already know that. And you will open up your Admission Navigator, scroll down here, and open up the PTA meds. You're going to left-click on this PTA meds. Now, again, this environment is the playground, so your production may be a little bit different than my screen looks, but for all intents and purposes, we're just going to use this. So if you click up the PTA meds, it'll actually open up this screen. And if you guys will follow along with me, these medications have already been entered as the patient's verbalized prior to admission meds, but I would like to go ahead and add some more. So right in this field, it says add prior to admission meds. So that's where I'm going to add a couple medications. I just type a couple of letters of the medication in there, and I click on this little add button right here. Automatically, it's going to bring me up a list of medications that look just like that medication, that couple of letters that I put in. So of course, I'm going to choose the correct medication. I'm going to make sure I have the correct route and dose, and I'm going to either double click or click on accept. And that's going to open up this box right here that will allow me to modify the medication perfectly to reflect the physician's order. So as you can see right here, I have two options to accept. So I'm going to shrink myself just a little bit. This is a prior to admission med that had been put in, so I'm going to accept that. I am going to change all of this to make sure it's correct with what the physician has ordered about this medication, and I'm going to accept. Okay, so once I do that, it will house itself down here alphabetically with the rest of the prior to admission medicines. Now, there's a little step that a lot of times people will miss because it doesn't really look like it's something that has to be done. So if you scroll down here, you guys can see there's a little box that says med list status, but there is nothing in it. So it's not like I can choose something or it will default to something. There's nothing there. However, there is a little drop down. Can you guys see this little drop down right here? And if you look very closely, this, I'm going to do the little drop down, and it's going to bring me up the options of which discipline actually entered these PTA meds. And I'm pretending that I am the nurse that did them, so I am going to put in that I, as the RN, completed them and put in RN complete, which is one of the options. Also, just FYI, I'm going to review the medications with the patient, and I'm going to click Mark as Reviewed. This is a standard at a lot of facilities to do. However, this piece right here, the med list status, where you put in who actually did this, if you do not complete this little single step, this will happen when you finish your admission. And I know you guys aren't wanting to see all these little red required documentation things hanging out there. And the frustrating thing is sometimes you'll click right on that PTA med list. It'll go straight to the PTA med list, and it looks like it's absolutely perfect. Everything was put in. However, this little simple step was missed. So that's all I have for you guys today about the documentation of PTA medications. What questions do you have about documenting PTA medications? None? All right. Well, again, I want to thank you for being here for my presentation. Again, my name's Heather Bell. I'm a registered nurse and an Epic credential trainer. And I hope that you guys have a wonderful day.